Hi there, my name is Dr. Lily. I am looking over your chart here and it says that you are having hearing issues. Okay, can you hear what I'm saying right now? So kind of like it's like underwater-ish. Okay. Well, to me that sounds like you probably have a blockage on both sides, no less. So we're going to take a look and we're going to get that cleared up so that you can get back to hearing all the things, good and bad. No, that's not something I can change. Let me start by taking a quick look. Okay, so I'm just going to use my otoscope to try to look inside. Well, honestly, I'm not actually seeing anything because my otoscope got stuck in your ear. Yeah, so I'm definitely seeing quite a bit of wax in there. Oh, it's not going to be a problem at all. Same with this one. Is getting stuck in it. So what we're going to need to do is go in. I'm going to see if I can't pull some of this out and get you hearing a little better, okay? I'm just going to be using a scoop here and really gently seeing if I can remove some of this wax. I got a pretty big piece of it, actually. Wow. I actually feel like maybe, can you hear me just a little bit better? See if I can't pick this out. There. Well, it's stickier than usual, which is why I'm having a little trouble. But I think I cleared just a little bit of a hole. Can you hear me just a little bit better? Okay. Yeah, I'm going to, just for communication's sake, I'm going to try to open up this one a little bit too, okay? Well, how have you been? Oh, well, it's definitely a helpful skill. I've had a little bit of difficulty hearing most of my life, and I should have learned to do that. Well, this can happen for a lot of reasons, and I'd need to know a lot more about you to tell you. Do you wear earbuds frequently? Yeah, like the kind that you put in your ear. Okay. Do you wear them to bed? Okay. And That can be a culprit, certainly. But not necessarily. I mean, first of all, you probably overproduce a little bit. How's that? Do you hear me a little more? That was a really big piece. Oh, good. Well, I have a collection right here. I'm gonna see if I can actually, like, see anything now. I want to make sure that your eardrum hasn't suffered at all from... Okay, I'm just gonna try and get this into your ear, okay? I'm still having trouble. I'm gonna have to pick out a little bit more. There we go. I'm seeing this one. I do see your eardrum. It does look healthy. It looks okay. It just looks, it looks a little bit red, but that's very normal when you have an impaction like that. So I'm going to need to bring out some more tools. Yes, we will get you all cleaned out here. I'm just going to go in with a little scoop here. It has a spring on the end. This is going to help pull out some of the bigger pieces. It's not scary. It doesn't have any sharp bits. You know, ideally I'd like you to stay as still as you can, but this is the perfect tool. It worked really well. Well, sometimes the products that we use can irritate our skin, right? It can do a similar thing with your ears, especially because a lot of people are use a Q-tip after they take a shower when they wash their hair. And if there's any product that got into your ear, you're essentially shoving it deeper into your ear. Earwax is the body's way of trying to protect your ear from irritants and bacteria and all of that stuff. Right. So when you push that in there, it's possible that your ear is trying to flush it out and creating all that wax, and then of course you're plugging it up. Okay, I'm going to do a little of this on the other side. Yeah, and please let me know if you're uncomfortable at all. We can always change position, take a break. Well, normally I would use eardrops to like soften everything up, but your earwax is oddly goopy. Yeah, it's a strange consistency that I'm not accustomed to, so well, I was concerned that it would react negatively with the solution. It's like usually like a mineral oil. Okay. And it's coming right out with the tools. I didn't really have a need to soften it. Really big piece here, and I'm hoping that this is gonna help clear up your ear. Okay, how's that? Yeah, I think that was the main one blocking your eardrum. Yeah, oh, I need to get the other one on the other side, huh? Because is it a little, like, uneven? Yeah, let me see if I can't get this one off so you can hear a little better. There we go. How's that? So, yeah, well, I'm trying to be really careful here. It's pretty massive. Okay. Yeah, well, there's still, I mean, good. I'm glad you can hear now. There's still quite a bit of cleanup that we need to do. Like, I'm not going to send you out with as much wax as you still have in your ears, okay? I'm going to use this now and see if I can't remove some more of this. Because I don't think that your hearing is at 100% yet with all this that you still got going. I just cleared a passage to your eardrum. Yeah, I think I'm gonna go ahead and prescribe you a couple drops. Yes, it is. It's super important. The eardrops will not, they won't prevent you from creating wax. They're just gonna slow it down a little bit. This is too much. I'm just cleaning the outside part of your ear here first. Trying to get rid of Yeah, I'm gonna give it a little bit of a brush so that you don't have all this like scaly stuff on the outside too. Okay, let me get the other side and then we're gonna go into the eardrum and I'm gonna get the rest of everything that's in there. We'll get you some eardrops. Yeah, you can just pick them up here. No, it shouldn't be a hassle. We probably have them in stock. Okay, I feel like I'm getting most of the rest of the stuff that's blocking your ability to hear. How clear is your hearing now? Okay, let me do just a little quick test before I finish up the cleaning, just because I want to make sure. Okay, I'm going to make sounds in different locations around you. I need you to close your eyes. Yes. Okay, no cheating. Okay. This say right, left, back, front, bottom. Okay. Okay. I need you to try and say it as soon as you hear it, okay? Okay. 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 I'm going to whisper a number into your ear. I just need you to repeat it back to me, okay?
27. 200. 84.
Okay.
41. 775.
Okay.
Lavender.
No, I'm changing to colors. Okay.
Cerulean. Maroon. Chartreuse.
Well, I'm purposefully picking obscure colors.
Puce.
Because I'm messing with you.
Magenta.
And to be fair, they're not obscure colors, they're just weird names.
Ultramarine. Blue.
Okay. Okay. Yeah, let me clean up the rest of what's in there. Well, let me take a look. Let me see if I can actually properly see your eardrum now, okay? Going to gently put the otoscope to your ear. Okay. Okay. Yeah, your eardrum looks really good. A little bit of redness, like I said. That slight bit of pain that you've been having. Right, is probably just from the blockage. How does it feel right now? Okay. Yeah, let me just finish up. I like my patients to leave totally clean. I'm just going to scrape the rest of this off the outside of your ear. And then if you don't mind, I'm going to go inside your ear canal just a little bit. And scoop out whatever else I can find, okay? I'm just incredibly impressed that you
managed to go so long without seeing anyone for it. You're one of those hide your pain kind of people, aren't you? Like a cat. Well, there's certainly social advantages to it, but as a doctor, I would highly suggest that you see somebody when you're in pain or when you can't hear. Just using a brush to get the rest of this. Stay really still for me because I'm going to go into the ear canal. Well, I think that with the eardrops, you can continue to wear earbuds the way that you have been. I think it should be fine. I'd like you to come back in 2 weeks, and I'd like to take a look to make sure. Okay. Let me get the other side, and then you will be free. Don't worry, we sanitize it, but it's got all these little metallic bristles. But they're so soft. They're blunted at the end so they can't, stab you or anything. And they just do such a good job cleaning up. Let me just go into the ear canal here really quick. I know. You're my last appointment of the day, unfortunately. Because it's winter, that sunshine's only got 45 more minutes, probably. It was really nice to see, though, today. When I was a kid, yeah, I did. some extent. I still do. Just get it really clean here for a second. I'm gonna go in the ear canal so it stays super still. There you go. I just get cold so easy, and I just miss the long days of summer. There's something magical about those long, long days. You know, the sun's up from 5 in the morning to 10 at night. Yeah. I don't know if it's just because I gotta stay up later in the summer when I was a kid, or just because things start to feel like magic when you're tired. Yeah, well, I mean, yeah. Some of the funniest, most strongly remembered times are when it was too late at night and I was a little bit sleep deprived. Yeah, so, needless to say, I am looking forward to the seasons changing. By February, I'm ready. Okay. Let me take a look and make sure I got everything okay. Okay. This one looks really good. Okay. If you don't mind, I'm just going to check. So there was quite a bit of wax on the outside of your ear, and it's kind of hard to see. It was clearish, and I don't want to send you home with sticky ears, so I think I missed some right here. Yeah, I'm just gonna make sure that you don't leave any of it left. Well, I am using no, you don't want to know. Well, like I said, 2 weeks. Schedule out there with Vanessa, please. I'd like to just do a check, partly out of curiosity, if I'm honest. Well, it is by far the most wax I have ever had to pull out of someone's ears. Nothing to be embarrassed about, I'm fascinated. So I just want to make sure that you're on the right track and that the ear drops are going to be working for you, okay? Oh, I definitely missed some right here. Okay. Alright. That looks good. 2 weeks. No sooner, no later. No, you can come sooner if you want. But no later, because I'm not giving you the extra strength ones. Right. Yeah, so it's not going, I don't want to completely eliminate your earwax production, okay? Okay, here you go. Alright, I'll see you in 2 weeks.